Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. The ancient Greek myth of Narcissus tells of a man who fell in love with his own reflection. He stared at and admired his own image for so long that he died and turned into a flower. The English word narcissism comes from this story. Today, when we see people overly admire themselves, brag, or behave in a way that we think is self-centered or arrogant, we refer to their behavior as narcissistic. But not all behaviors that people think are narcissistic are a sign of the mental health condition known as narcissistic personality disorder. In this video, we discuss the difference between behavior people may casually refer to as narcissism and narcissistic personality disorder. Worldwide, online searches related to narcissism rose steadily over the last 20 years, and Google searches on narcissistic personality disorder spiked in 2022 and 2023. But this information can be untrue, and people can become quick to label others as narcissists based on inaccurate information. In fact, narcissistic personality disorder is uncommon. And it's also less common than other mental health problems like depression and anxiety. Narcissistic personality disorder is a mental health condition that involves a pattern of behaviors enduring over years, such as being overly concerned about one's own importance, beliefs about being extra special, an obsession with power and status, lack of concern about the feelings of other people. To be diagnosed with narcissistic personality disorder, people will most likely have shown many visible signs of narcissism since they were young adults. People with narcissistic personality disorder experience a negative impact on their lives and their relationships. They easily experience disappointment in other people, feeling let down or unappreciated by them. How we use words like narcissism matters. People sometimes use the word narcissist casually to talk about someone that is acting in a way that is selfish or that fails to consider the needs of others. Such actions can cause problems and be hurtful to others, but that does not automatically mean the person has narcissistic personality disorder. It's also important to know that across different countries and cultures, there are differences in what people think is an acceptable level of focusing on one's personal specialness or importance. An action that is considered narcissistic in one part of the world may be accepted or encouraged in another. So let's be careful about how we use words like narcissist in our everyday life. And let's avoid casual and dismissive comments about people having personality disorders when we find people difficult, somehow blaming them and trivializing the diagnostic term at the same time. Everyone can be a little self-centered at times, including me. But few people will have narcissistic personality disorder. Let's leave formal diagnosis to mental health professionals and be careful about using diagnostic labels to attack, diminish, or dismiss people. You can be a jerk without having a diagnosable mental illness. It's actually insulting to all the nice people who struggle with mental illnesses to assume that when someone acts like a jerk, that person must be mentally ill. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.